It's funny seeing you walk out of the airport and you're just in shock. You're like, oh my goodness, I'm scared, I don't know what to do. Then when you leave, you're a lot more comfortable.
I've been working in the hospital since right after the earthquake. At that time we were at the 10th hospital and we moved over here 6 months after the earthquake.
Encuentro que es un buen hospital. Hay falta de recursos, sí, no tenemos todos los materiales necesarios, pero hacemos todo lo que podemos, todo lo que es en nuestro alcance para ayudar a los pacientes cuando llegan aquí.
We have outpatient physical therapy, outpatient wound care, outpatient orthopedics. We have a prosthetic and orthotics lab. People were able to get fit for braces, for legs, for arms. Inpatient physical therapy for spinal cord, inpatient physical therapy for anybody else. We have a CT scanner, we have X-ray, we have a lab that's fully functioning. Basically anything you would see in the States.
This hospital is one of the only trauma hospitals in Port-au-Prince. Most of what I've seen is trauma, and pretty serious trauma. So quite a bit of, infectious disease, as you would suspect, seen, HIV and TB and, diarrhea, cholera, those kinds of things.
So I was kind of expecting, pretty much people asking me to work outside of my comfort zone, which so far it's, the case, dealing with neurosurgery cases that I don't really deal with on a daily basis. So you just have to come in expecting to deal with, cases that you're not familiar with, and just do the best you can.
So in one room I'm dealing with critically ill patients, and then in the other room, in triage, I have all these lacerations, which that's fine. So basically, if I want to take a breather, I'll go and do some lax, and then afterwards I'll go back in the main room and deal with the critical patients. So basically just going back and forth from comfort to comfort and discomfort again.
The cultural differences, the way that people grieve here is different, the way that people experience illness, the point at which patients want to continue on or want to stop medical therapy is different. So I think, definitely a lot of the cultural things, and also just how to work in their setting.
We do have a new cycle of volunteers each week. So these are people that the permanent staff have to adjust to each week. And although they work together nicely and all these things, but just imagine how it would be in your workplace, if you had to get used to new people each week. Someone telling you this way is better, this way is better, this way is better each time.
Just recognize that things are done the way that they're done for a reason, and in a short time period like this, I may or may not gain access to that reason.
This right here will remind you why you went in healthcare. Because I'm a volunteer, I paid a good amount of money to come out here, I would do it again. Because this changes you as an individual.
There's a lot of people who come down initially for a resume booster. And so those people right away, you can tell that who those people are. And those people typically don't tolerate this well, because we ask you to work a lot. And so if you're just here for yourself, then it's not good. But if you're truly here for the Haitian people, it's hard, but you'll come back. It's very rewarding for that.
The project is doing something really big and great for Haiti. So it's not about the project, it's about Haiti. So when I say Haiti, it's about the people.